I'm here obviously this morning with Dr. Jeremy McAnulty, who will give us some details of some of the more intricate parts of what we're going to talk about, and also Mr. Dominello, who's going to be talking about the QR codes and the application of QR codes. First of all, I'd just like to address the numbers to 8 p.m. last night. Pleasingly, to 8 p.m. last night, we had 0 cases of local community transmission. We had 2 cases who are in international hotel quarantine, and we had 20,437 tests done. Now that's slightly less than the day before. It's pleasing, it's up over 20,000, but I have to say again to New South Wales community that it is absolutely critical that if you have any symptoms whatsoever of a flu or cold-like illness, that you come forward and get tested. It is, on the face of it, very positive that we've had 0 cases of local transmission, but of course that's entirely dependent on the numbers of cases who come forward. We need people to come forward to be tested. That's the weapon that we all have as locals, as community members, to be able to ensure that our public health teams can back us in and make sure that we have the correct knowledge, or the absolute knowledge of what is circulating in our community. Can I also just address a number of other issues? First of all, there's been some queries and questions about the upcoming Australia Day celebrations. Can I just advise councils in the greater metropolitan area, and obviously there are differences between the greater metropolitan area and the broader parts of the regions of New South Wales. If councils wish to have Australia Day ceremonies, and hopefully they will, they can certainly have those with up to 500 people without any major concerns. They can have more than that if it's a more structured environment, of up to a couple of thousand. But within 72 hours, New South Wales Health will have on its website details so that councils don't have to make necessarily individual applications to our public health staff. Obviously there have been a number of councils who have been in contact already with New South Wales Health asking for what arrangements they can actually enter into for Australia Day. But I emphasise you can certainly have Australia Day celebrations and just with those limits. I also want to address the issue of the Grand Chancellor Hotel in Brisbane. Late yesterday, and I want to thank all the media for getting the message out so quickly yesterday afternoon. There were concerns obviously from Brisbane on the basis of one of the variants of concern, one of the variants of the virus being present in as confirmed by genetic sequencing in the hotel, the Grand Chancellor in Brisbane. And as a result, the Queensland Government issued advice very late yesterday that if you had been in the Grand Chancellor since the 29th of December, it may well be that you should be self-isolating and getting tested. I'm very pleased to be able to advise that New South Wales Public Health has now been in contact with all 10 people who were from New South Wales, and they are all in self-isolation and being tested, and so that is being managed appropriately. There have also been some question marks about whether or not we should be using regional hotel facilities for our hotel quarantine system. I just want to emphasise that this has been looked at very closely by the New South Wales Public Health team over the full duration of this particular pandemic, which of course is almost, for us, a year ago that it commenced. It was the 25th of January that we had our first 4 cases. And on any one day in our hotel quarantine system, we have about 3,500 staff, many of them specialist medical staff, just in our hotel, health hotels, or special health accommodation. we have about 650 people in that situation. That's the equivalent of a Royal North Shore. In fact, it's slightly bigger than a Royal North Shore hospital. So there are obviously very strong views held in our public health team that it makes sense to continue to have the hotel quarantine arrangements that we currently have. One of the other very serious concerns that public health would have if they were moved into the regions is that, first of all, there are challenges around the transportation of people who've come from overseas with possible virus from overseas, being in a bus for an hour or two to whichever region may be considered. But we simply do not believe, the public health advice here in New South Wales, that we do not believe that there would be any advantage, in fact distinct disadvantages for us to be considering moving our public health hotels out of the Sydney regional area. There's also another critical factor, and that is if we do get people who deteriorate, we want them to be able to be transferred to a major tertiary hospital as quickly as possible. In other words, one that has the preeminent specialists available to look after people who may end up with COVID. Of course, that system has worked very well. There's no doubt about it that our specialists, our medical specialists, our physicians who have looked after patients who have had COVID-19 have very, very successful outcomes because of their expertise in managing COVID-19. Finally, I'd just like to say that there obviously is a continuation of our serious surveillance. Yesterday, I think it was yesterday, Dr. Chant mentioned that there has been some positive results in positive case indication in Ulladulla in that sewage plant, but I'm pleased to say that that has now gone negative. So that would be a very happy news for the people who live in that area. I'm going to ask now Dr. McAnally to make some comments and some more detail on some of those issues, and then I will ask Minister Dominello to make a comment about the QR code and usage thereof. Thank you.
Thanks very much, Minister. So as the Minister said, we reported no cases of local transmission of COVID in the 24 hours at 8 o'clock last night, which is great news. The last time we had 0 locally transmitted cases was on the 6th of January this year. There were 2 cases in people who returned from overseas and in hotel quarantine. This brings a total number of cases in New South Wales since the beginning of the pandemic to 4,854. Look, while we've seen before days without cases, what we want to avoid is complacency. We know that we can have runs of days without any cases, but then cases pop up again. So we need to maintain those high levels of testing across this coming period to make sure we find any possible case. That said, we've seen better numbers in the last couple of days with 20,437 tests reported yesterday compared to 20,664 the day before. We want to see over 25,000 tests a day, and we're keen that people in those areas where we've seen recent cases, particularly in Western Sydney, to Southwest Sydney and the Northern Beaches, to still be coming forward at the slightest of symptoms. But it applies to anyone across the state. If you get any tiny symptoms, just don't hesitate. On the day you get those symptoms, come forward for testing. There are plenty of clinics, over 300 clinics across the state where you can get tested 7 days a week. It's important that people support each other to get tested as well. So if we're asking people to come forward directly, but if you see someone in the family or one of your mates who seem to have symptoms, just egg them on to get tested. Do the right thing. And GPs have a particularly important role, and we're working closely with GPs to make sure that, as leaders in the community and seeing patients, that they're aware to and encouraging people to be tested at the slightest symptoms as well. Even if there's thought to be another diagnosis, we want to make sure that people are tested. And don't be afraid to get tested over and over again. If you had a runny nose last week and then different symptoms this week, go and get tested again. There's no harm in doing that, and it's very important. Regarding the Grand Chancellor Hotel in Brisbane, as Melissa said, we received a report yesterday from Queensland, issued a media alert to identify people who may have been in that hotel from the 30th of December onwards. And we've had reports from Queensland of 10 people. We've entered New South Wales subsequently. Those 10 people have been contacted. We understand they're well, and they'll be getting tested and maintaining self-isolation for at least 14 days, and if they're well, they can then be discharged. And we thank those people very much for making sure that the community is safe. Thanks very much.
Well, thanks everyone. We've hit a number of important milestones in relation to contact tracing and the use of the QR Service New South Wales feature. There have been more than 3 million people in New South Wales that have downloaded the Service New South Wales app. Over 100,000 businesses have registered customers with the QR code, and that's great news. There's been about 32 million COVID-safe check-ins using the Service New South Wales check-in feature, and that includes 1.7 million pieces of feedback from people with a 94% thumbs up. So that again is very encouraging. Now, in terms of compliance, so far this year there's been over 486 inspections undertaken. Now, as of yesterday, 71% of mandated businesses were inspected are using the Service New South Wales QR code system. So obviously there's room for improvement there. I want to thank the businesses that are part of the 71%, and for the ones that are not, you have to lift your game. We are still in this pandemic. You have to lift your game. You have to protect your staff, you have to protect your customers, and you have a broader obligation to the New South Wales community to have a play there to protect us all. In terms of infringement notices, as at 13 January, that is yesterday, a total of 320 penalty notices have been issued, with 2 of these issued as of 11 January. And we have closed a total of 4 venues temporarily since the beginning of the pandemic. So again, we are prepared to close businesses down when they are flagrantly breaching public health orders and putting everyone at risk. Now, in terms of industry information, there are about 38,000 hospitality businesses and 20,000 hairdressing and beauty salon businesses in New South Wales, and obviously they are the cohort that are part of the mandation required under the public health order to have the Service New South Wales QR code in place to help our contact tracers. And finally, just in terms of inspectors on the beat, I just want to reassure everyone that they continue to do enormous work. Like, they are literally also on the front line doing the tough job, and it really is tough work, as we've seen recently when tempers fray, of going in there and encouraging businesses at first instance to do the right thing, and then issuing fines if they fail to do the right thing. We have more than 200 New South Wales government inspectors that have been authorised under the Public Health Act to carry out COVID-19 related inspections. That includes great people from Safe Work, Liquor and Gaming and New South Wales Fair Trading. And in addition to those 200 inspectors, we also have local council inspectors and the New South Wales Police, again, doing magnificent work. So if people think that they can escape and not do the right thing, it is only a matter of time. You will get that fine. You will put your customers, your staff, the public at risk. And unfortunately, we don't want to shut businesses down. In fact, we want to do the opposite. We want to encourage businesses to stay open, but they must stay open in a COVID-safe way. Thank you.
Minister, Queensland, Minister Hazard, sorry. Yes, Queensland has obviously floated this idea this morning of putting hotel quarantine into mining camps. What is your thought on that specific proposal, and would New South Wales support anything along the lines of that here?
I have seen that proposition from the Queensland Government, and I think the first thing is that each state and territory have different geographical circumstances, different transmission issues in terms of the virus. I think that it's not appropriate for me or for the New South Wales government to comment on what Queensland might propose. I can say, as I said earlier, that New South Wales certainly doesn't see the benefit for us in following that path. We have a very effective hotel quarantine system. More than 114,000 people have been through that system, and every day there are 3,500. Every day there are 3,500 health and police and other staff who are actually making sure our hotel quarantine system works. So for us, there is no benefit in considering such a proposition, but Queensland, of course, they can consider whatever they think is appropriate for their Queensland environment.
One big element of that particular thing is getting all the workers on site so that they stay there, so it doesn't leak out in the community. You know, we don't have cleaners coming and going. Is that something that could feasibly be done at all? Something that New South Wales would consider, either in the city or anywhere else?
Certainly, we have looked at whether or not it was feasible to have staff stay in the hotels, which really isn't feasible. We have, as I said, more than 3,500 staff on any one day. It would simply be impractical, but there's a very substantive reasons, and that is that our health staff and the very senior staff that we have looking after people in hotel quarantine have indicated quite clearly in the earlier phases that they are happy to be involved, happy to work hard, happy to keep us safe, but they would like to be able to still have some degree of normalcy in their life. So at this stage, we've had more than 114,000 people go through our hotel quarantine system. As I said, we have more than the entire patient load of Royal North Shore Hospital in our special health accommodation facilities being looked after by medical staff. It would not be logical for us to, on the basis of less than, I think it's 3 incidences now over the last year, it would not be logical for us to move that arrangement out of Sydney. And nor would it be fair or practical to follow that path. But look, if Queensland can do it, also have to remember that each of the states and territories are taking nowhere near the number of people from overseas that we take. A fraction, in fact, and that in itself presents an entirely different situation. If we consider, for example, Western Australia, we alone have 3,000 air crew a week coming through New South Wales. They have less than 300. Victoria for a long while had nobody. Queensland has far less than what we have. So we have the biggest system by far. Roughly 43% of all of the people who come through our hotel system we are looking after for other states and territories. There's no doubt from the public health staff's advice to the government that the current arrangements are the best possible. Having said that, the public health team have also stepped up audits of the hotels and looking at any holes, and it's a human system, as we've talked about many times over the last year. It's a human system. And it's always possible to find something that we didn't know existed as a hole in the system. And that's something which our public health staff and the police and others working in our hotel quarantine system work at all the time. As I said, we also have regular audits to make sure that we're plugging all those possible holes.
Minister Hazzard, given that the biggest threat that we do have to the community at the moment is from these returning travellers, and we know that the workers are being tested, is there any way we could amp up what we are currently doing with our testing, not only of those workers but potentially of their household contacts, to increase that barrier?
Certainly public health have, as I said, had regular audits and continue to have audits, particularly as we look at the variants of concern overseas. And as Dr. Chance and as the Premier have said on many occasions, those variants are eventually probably going to be what we're dealing with. When viruses do vary, that's just they do vary regularly. And so we'd have to be looking at the fact that we would have variants at some stage more broadly in the community, but that also means that in our health quarantine system, it's important that our public health staff do the reviews and audits that they do. And if there are any other issues that need to be addressed, of course they will address them.
Are
Is
you
there
concerned
anybody at the moment?
Sorry, Ashley.
Is there anybody at the moment who tested positive in hotel quarantine? Do they have the UK strain? Do you know?
I'll ask Dr. McAnulty to answer that, but I think there is. But can I just say this, that getting overly obsessed about a British variant or a Nigerian variant or a South African variant, there are many variants. And those variants are out there and they're coming from many countries. So as we move forward, we can expect it to become more of the norm, because we're getting more and more people who have positive cases coming from overseas. As the virus does its worst across the rest of the world, Australians coming back are more likely to have the virus or a variant thereof. So of course we have to manage that issue, and we are managing that issue. But I'll ask Dr. McAnulty to comment about the cases that are in the current environment.
Thanks, Minister. So we've had a total of 18 variants of concern since November. Of those, 14 remain in the special health accommodation. We have processes in place where there's a review of every person in the special health accommodation with COVID to make sure that they're being tested for the variants of concern, and then an expert panel will assist in making sure they're not discharged prior to them being safely.
Is there anybody at the moment?
So there are 14 people, I understand.
Right now?
Yes.
And how many variants of concern are there, and can you list them for us?
So there are two main ones, but new ones are emerging around the world. So we've had, and they're named after the country where they were first identified, but that doesn't mean that they're not in many other countries as well. So we've had, of those 18 in total, we've had 5 from South African strain and the remainder the UK strain.
Minister Dominello, the milestone of hitting 3 million downloads, albeit a fantastic milestone, it's less than half the population of New South Wales. Surely a lot more people have phones that should have that service downloaded.
Oh, look, this is something that we are progressively rolling out, and obviously we've got the Dine and Discover vouchers that are coming out very soon, and if you want to access that, you're going to have to download the Service New South Wales app, because it again provides people with that ease of use. But let's not scoff at 3 million. That's a significant number of people in New South Wales. When you think that we've got a population of 8 million, about 6 million adults, and say 5 million of those that are, shall we say, engaged. 3 million is a pretty good milestone, given that we only made this mandatory as of 1 January.
Are you confident with the system that's in place that there might be outages from this app?
Look, we saw an example of that last week, I think it was, where we had 2 hours of outage. Now, am I saying that digital is perfect, QR code is perfect? No, it's not. But it is a damn sight better than paper and pen. We've had over 30 million bits of information going directly to the contact tracing team at Health. Now, that's information that's going in a digital format through QR codes that previous to QR code would have been done in pen and paper. Now, I think, as Mr. Hazard said time and time again, pen and paper, there's enormous irregularities around that you don't get with digital. So what we've seen in this pandemic is that we have to be fast, we have to be agile, and we have to be laser-like, very targeted, and digital's the only medium to do it.
After that outage last week, has there anything changed to ensure that doesn't happen again?
That was a technical problem that has been resolved, and we are constantly learning through this pandemic, and the IT systems are no different. But we are stronger today than we were yesterday and 2 weeks ago. But there was a glitch for 2 hours. But equally, when there is a glitch in the system, there's always fallbacks. And in the case of last week, there was always the ability to go through the web browsers and put your details through the web browsers. And in fact, in the half hour prior to us fixing it up, there was about, I think, 17,000 people that used the web browser. There's also the ability for businesses to record through their tablets and their electronic devices. And again, as the ultimate fallback, you've got pen and paper.
Mr. Hazard, just given that there are 14 active cases of different variants, are you concerned at all what's happened at the Hotel Grand Chancellor in Brisbane could happen in New South Wales? I think there's lots of questions, people are concerned that this could happen here. What do you say to that?
Look, I think the Queenslanders are actually working their way through a review of what has actually happened at the Grand Chancellor. I think it's fair to say that we're always on high alert about what might happen. It's a human system. I suspect that in the end they'll find that there was some human breach there as well. But that's a matter for them. I have confidence in our public health system and in the quarantine system, and our public health team are second to none. So the people who are managing these health hotels and the police hotels are doing an excellent job. And I want to add, actually, since I've been asked, I want to thank, I was reflecting on this a little earlier today, that we've all come just to accept the fact that there are thousands of health staff at the front line still working on this, public health staff working 24 hours a day, police working massive hours. I think we should, as a state, be very grateful for the fact that we have so many committed frontline staff on this in this COVID pandemic. So thank you on behalf of the community and the government to all those staff.
May I ask, it may be a question for you or maybe Dr. McAnulty, but of those people and of those strains, are we concerned that there has been any transmission between those people in a similar way that we've seen in Queensland?
No.
So therefore, how transmissible
I'm
are
glad he's
these?
agreeing with me. No.
But how transmissible are these? Obviously, these people are on planes together. Yes, they're wearing masks,
Look,
but they're
the
in cars
virus,
together.
we wouldn't all have a pandemic if they weren't highly transmissible. The virus is transmissible in its original forms, but now there are variants that are, as we're describing them, variants of concern because they are even more transmissible. But the good news so far is that there's no indication, no clear indication anyway at this point, that they make people sicker. They don't have any great difference except the fact that the transmission is actually much quicker and it would appear to be more transmissible. So that certainly has implications for us, implications for everyone around the world. But we're also looking forward, can't tell you how much I'm looking forward to getting the vaccines rolled out as soon as the TGA and the federal government think it's appropriate. I'm really looking forward to that.
Will those variants reduce the effectiveness of the vaccine?
Sorry.
Will those variants reduce the effectiveness of the vaccine?
No, actually the advice to date from the epidemiologists is that the vaccines that are coming to us will have equal effectiveness with the variants, so it's not a real issue.
Minister, on the interest of, or the issue of people returning to work, there's a lot of evidence now that big companies are advising people not to come back to the office, banks and so forth. Now, should the government, public service, lead the way here in terms of getting public servants back to the office? And
I think obviously the first variation of the health orders, many months ago, was to effectively say to employers, if your staff can work from home, let them. But that order's now changed. We see no reason to actually change the current arrangements, which largely leave it to the employers and their staff to determine whether or not people should be at work. But I think it's fair to say that, to my mind, most employers, particularly the larger ones, are being very reasonable and very sensible and talking to their staff about just whether it is necessary for you to be operating within an office structure or whether you can work from home. So at this point the government sees no reason to be directing a business or employees as to how they should deal with their lives in terms of their work, but certainly I think clearly it's a COVID pandemic, a balance is appropriate, and so far business appears to be doing precisely that and making sure that their workers, if they're not absolutely crucial in the office, are not required to be there every day of every week.
And that includes public service, then, I gather.
I think most of the, certainly a few months ago we were concentrating, before we were focused so much on the variants, we were concentrating on trying to make sure that the public sector did lead the way in terms of staff coming back, but I think we've generally there's a balance that's occurring there as well. Certainly in my office, my chief of staff runs the show, and I see that most days she has about half of the staff in the office and they're well spaced, and I think that's fairly typical.
And on the issue of violence around masks, we've had another incident in Windsor there. A fellow security guard was punched, another person was stabbed, simply asking a fellow to wear a mask at a venue. I know we've asked this a few times, but just with you.
You have
that
asked
kind of
a few
behaviour.
times.
Well, I may.
Look, I just say this, wearing a mask is absolutely the fourth line of defence. We've talked about the various lines of defence that we have. Wearing a mask is something that we should all be doing if it's within the environment that has been laid down by the public health orders. And certainly if someone is asked to wear a mask when they're entering premises, they should comply. People who don't will have the full weight of the law thrown at them, but it's more than that. Really, we're all in this together. For heaven's sake, individuals who think that they can actually not wear a mask are just kidding themselves. Wear the damn mask is the message.
Minister, just one from my colleagues at WIN. They'd like to know what is the state government when is the state government looking to ease restrictions for Wollongong, considering there have been no new cases in the Illawarra for 3 weeks?
Look, obviously, the public health team are looking at those issues constantly, but at the present time, we're asking that they continue as part of Greater Sydney. The restrictions are not overly onerous for all in Greater Sydney. I have to say that as I move around, when I can get outside, people seem fairly happy with the current arrangements. So I think certainly there's. I'll ask the public health staff to have another look at that specifically for the Illawarra residents. But at this point, it would be wise just to allow the public health team to do their job and to follow those instructions closely.
Minister Hazzard, has there been any progress made with critical shortages in particularly rural and regional parts of hospitals in Western New South Wales?
I'm sorry, shortages of what?
Of doctors and staffing shortages. There's a huge focus at the moment on people getting telehealth in remote parts of New South Wales.
Oh, I see, yeah. Look, the state government has been working extensively to try and encourage and find ways to get more health staff into the smaller communities, but it remains a challenge right across Australia to get doctors particularly into very small communities. The opportunities that have grown out of telehealth and virtual health are enormous, because what it means is that somebody who is in a remote small town where there are no GPs, there are no other doctors, can actually have world-class specialists giving them the advice and service that they need. But we're also doing a whole range of other things. We had recently, I was up at Dubbo in an all-day conference there working with regional health teams about what sort of encouragement we could give to staff to move into those regional areas. And of course there's been a lot of initiatives around trying to identify people who want to study medicine, for example, in regional areas, and offering programs by universities that we also work with in those regional areas. But again, this is a problem right across Australia in remote regions. It's not a New South Wales only issue. And indeed, it's an issue for many countries across the world. I have actually been in a venue in Tel Aviv, in Israel, where ICU specialists were managing more than 60 hospitals in northwest United States because there were simply not available staff across those hospitals in northwest America. So this is a worldwide issue, and I can just assure you that the state government here is certainly doing all we can, working with our federal colleagues, to try and address those issues.
Last question, please.
No more questions. Thank you all. Yeah, thank you very much.
I do have one for...
Sorry, one from Christopher.
Yeah, Dr. McNally.
Dr. McNally.
Yeah, just to follow up on the Mount Druitt couple there in terms of an infection source. Any luck?
Yeah, not so far. We're thoroughly investigating a range of commonalities with other cases and other contacts to look for links. The investigation is continuing, but so far we haven't found any solid link. But that's not to say we won't. In the meantime, there's been lots of contacts identified and tested and placed in isolation, and we haven't found further transmission at this point, which is good news.
And is that the same for the Northern Beaches couple?
Thanks, guys. Thank you.
Probably.